Good evening, I'm Leslie Rohde. Robert Hadlock is off tonight. Tempers are flaring as the state weighs what its women's health care program could look like after the federal government pulls funding. The program provides services from cancer screenings to birth control for about 130,000 women here in Texas. Nearly half of those are Planned Parenthood patients, the group battling the state over this controversy today. Our political reporter Josh Hinkle joins us live from outside a packed hearing with more. Josh?
Leslie, let's make it simple for you. The state says because of its ties to abortion providers, Planned Parenthood should not receive any of this money. And as a result, the federal government says Texas shouldn't receive any of it either. So now Texas wants to create its own women's health program. And you guessed it, it doesn't want Planned Parenthood to be a part of that one either.
I learned that I have human papillomavirus, the virus that causes cervical cancer.
When Amy Camp found out she had this potentially life-threatening disease, she turned to Planned Parenthood for regular screenings. Now working one job and looking for another, she still has no insurance and very little money to pay for that prevention on her own.
If it's not monitored, that's how women develop cervical cancer.
Camp is just one woman speaking out against the state's plan to keep Planned Parenthood out of the women's health program. A busy, cash-strapped mother.
5 college classes, 2 young kids.
A woman not ready to be a parent.
They help me prevent any unwanted pregnancies.
People who felt like they had nowhere else to turn.
How could someone decide to vote against thousands of women?
Despite those important services, abortion still remained the sticking point for many at this state Health and Human Services hearing.
You're a college student, you're not married, and you're pregnant? Give me a break.
This argument, even though money for the women's health program doesn't go toward abortions.
I am not in favor of tax dollars being used to promote abortion.
In a time when legislative budget cuts have forced dozens of family planning clinics to close, the state says women Planned Parenthood now serves could still find another provider. But there is concern there are not enough clinics to go around, and doctors might not even be willing to take on this huge influx of low-income patients. And the biggest question, where is Texas going to get all of this funding so it can go out on its own when it doesn't have those federal funds? Well, that question is up for debate, and if possible, we could have an answer out of this hearing sometime today, but they do have a little bit of time to reconsider all of this program as the rule does not go into effect until November. Josh Hinkle, KXAN News.
Josh, thank you for that. A major move for the cash-strapped Planned Parenthood over the weekend. Several groups along the I-35 corridor merged to form Planned Parenthood of Central Texas, of Greater Texas, rather. They plan to coordinate resources, donations, and other funding to reach the most patients.